Connect the patient's feeding tube to the distal end of the legacy ACE. Next, insert feeding administration set into the white bushing of the ACE connector. Turn ACE control handle to on for enteral formula to flow. To administer meds, turn ACE control valve to off position. Insert catheter tip syringe, being sure to twist and push it into medication port. Administer meds. Follow up with the flush of the ACE connector and NG tube. Remove syringe. Turn valve back to on position to resume feed. Remove white bushing from ACE proximal port. Connect Salem sump NG tube to the distal port of the ACE connector. Connect suction tubing to the ACE proximal port. Then turn ACE handle to the on position to begin suction or decompression. Remove white bushing from ACE proximal port. Connect Levin tube to the distal port of the ACE connector. Connect suction tubing to the proximal port of the ACE connector. Turn the ACE handle to the on position to begin suction or decompression. Unplug center feed cap from PEG, PEJ, or BRT tube. Insert the distal tip of the ACE connector into the center Y port. Insert the feeding administration set into the proximal port of the ACE connector. Turn the ACE handle to the on position to start the flow. Attach Salem sump tubing to ACE connector. Connect feeding set into white bushing. Turn handle to on position for feeding the flow. To sample gastric residuals, turn ACE handle to off position. Insert syringe being sure to twist and push into the port. Slowly withdraw gastric residuals into the syringe from the patient's NG tube.